Hello, my name is Kristen Hessler, and I'm here to educate you on Wolff-Parkinson White syndrome. The objectives for my presentation are to inform you of what exactly Wolff-Parkinson White syndrome is, to discuss the causes and effects, inform you of what the possible symptoms are, and then to explore the treatment options. In order to understand how Wolff-Parkinson White syndrome works, it's important to understand how a normal heart works. So the normal heart is made up of four chambers: the upper right and left atrium and the lower right and left ventricles. The sinus node, or the SA node, sends electrical impulses from the right atrium to the left atrium, which causes them to contract and fill with blood. From here, those electrical impulses travel to the atrioventricular node, or the AV node, which slows down the heart rate and further sends those electrical impulses to the ventricles. When the impulses reach the ventricles, they contract and fill with blood. That blood is then dispersed to the lungs and to the rest of the body. The heart works a little bit different in Wolff-Parkinson White syndrome. Wolff-Parkinson White syndrome is a condition in which a person's heart contains an extra electrical pathway. So rather than those electrical impulses leaving the atrium, stopping at the AV node to slow down, they are sent directly to the ventricles. The skipping of the AV node causes the heart rate to be much faster, and it does not allow the ventricles to contract and fill with blood properly. Causes of Wolff-Parkinson White syndrome are not very known. Some researchers believe that a person may have an abnormal gene, but for the most part, there's no real cause as to why a person ends up with that additional pathway. There are several effects a person can have from Wolff-Parkinson White syndrome. The first effects would be abnormal heart rhythms. The first abnormal rhythm would be atrial fibrillation, or AFib. AFib is described as an irregular heart rhythm which causes a person's right and left atrium to beat out of sync at uncontrolled rates. This can often lead to blood clots. The second abnormal rhythm would be tachycardia. Tachycardia is when a person's heart rate is beating greater than 100 beats per minute. Next, an effect would be looped electrical impulses. Looped electrical impulses are described as impulses that travel down either the normal or extra pathway and up the other one, which creates a complete electrical loop of signals. This is going to lead to the ventricles beating very fast. In the most rare cases of Wolff-Parkinson White syndrome, there's a possibility of loss of consciousness or cardiac arrest. Symptoms in infants include lack of activity or alertness as described by their parents, shortness in breath, poor eating or lack of interest in eating, and a noticeably faster heart rate. Symptoms in adults include the sudden sensation of a rapid or fluttering heartbeat, lightheadedness and dizziness, anxiety or tiring very easily, chest pain and chest tightness, or difficulty in breathing. Wolff-Parkinson White syndrome has very promising treatment options. For someone who's displaying zero symptoms but are aware that they have the condition, their physician may just want very close observation on them. For someone who is displaying those abnormal rhythms that I previously discussed, an antiarrhythmic medication such as amiodarone may be prescribed and taken regularly by that specific person. The most promising option, however, is catheter ablation. Catheter ablation is when a catheter is inserted into a person's artery through a small incision in their groin. This catheter then travels to the person's heart and uses heat to destroy that extra pathway. This has a success rate of 85 to 95%. So, Wolff-Parkinson-White syndrome is a condition in the heart where the heart contains an additional electrical pathway. This rare condition affects only every 4 out of 100,000 people. It has extremely promising treatment options. At this time, I would like to thank you for listening to my presentation, and I hope you enjoyed learning about Wolff-Parkinson-White syndrome as much as I've enjoyed presenting this information to you.